Massachusetts. We are the 4th largest employer in Massachusetts, and we see over 1 million patients annually. I have no financial interest to disclose. Today what I want to do is talk about 2 topics. One is the strategic rationale for hospitals and for all of us to really think about implementing a sugar-sweetened beverage reduction initiative, and 2, successes and challenges once you do that implementation. I talk kind of quick. I'm going to try to plow through it. You've been very patient. These slides are going to be published from what I understand, so you'll have access to them, so don't worry about writing down as much. So the strategic rationale for hospitals to do this there are a myriad of them. One, hospitals are often self-insured. And as we heard earlier today, this is a real health issue. So if you're self-insured and you can save from ensuring that your own employees are not incurring unnecessary medical expenses, it's a wise thing to do, obviously. Payment reform, I'm going to talk a little about that in the context of health reform. Corporate social responsibility. There's a school of thought now, Michael Porter and the gang at Harvard, focusing on the importance of corporate social responsibility and the importance of organizations that do that to improve their bottom line. And lastly, there's a way in which you can do this to actually increase the margins, not lose money. And I'll talk a little bit about that. Never want to miss the opportunity to talk about payment reform, or really health reform, when you're doing presentations, specifically inside or outside of health reform, and we all hope it sticks, at least I do. But if it doesn't stick, payment reform is real, it's here. Hospitals moving into what's called ACOs. We're an ACO, Affordable Care Organization. One of the 35 or so pioneer ACOs is one of them we are. But what I want to talk about is the notion of kind of the fee-for-service model, and then moving into this newer model of care, the global payments, because I think it's a tremendous opportunity for public health types to get involved and come up with creative programs such as this that can help reduce the total expense. So on the left, you'll see that DRG, that fee-for-service model, and we all know it incents us to continue to utilize services. It incents unnecessary tests. But we're moving to, on the right, this question of the global payment systems that are really a part of these ACOs. And under that global payment system, instead of getting paid every time somebody comes in, you now get paid a bundle of money, and you make money by keeping them out of the hospital, right? Healthier folks, lower medical expense, you make money in that way. So programs such as this, if we know that this indeed is a health issue, and we know that we can reduce the total medical expense, there's a real way that if you're strategic, not only for this program, for other programs, if you want to approach hospitals and say, I can help you to reduce costs, I can help you to keep folks out of your hospital if you're moving into this model, I think you'll start to have more receptivity than you had in the past, right? This slide shows the importance of us all rowing together and moving in the same direction. Up top, we all know with all these myriad of community groups protecting their own interests, that at times we can be moving against each other. People are more concerned about position preservation or preserving the long-term interests of their specific group, and less about the community as a whole. So what I argue is that hospitals can take a lead along with other agencies to move in a direction that actually improves the community's health, and we do that by a give and take and by working together, and I think this is a perfect example of that. Talked about some of the items that I want to focus on, this notion of corporate social responsibility, CSR. How do companies manage their business processes so that they can produce an overall positive impact on society? And I could argue that this sugar-sweetened beverage reduction initiative is one of those issues. It's one of those things that we are getting a good PR from doing, and we are actually increasing our potential to have a benefit of doing that. So there's a whole school of thought now, firms of endearment, to play on terms of endearment. Those firms that this book has indicated are those companies that actually do good in the community and do good financially as a result of doing good in the community. Capitalism is at crossroads, social entrepreneurship. In terms of firms of endearment, here are some of the firms that this book lists. These companies do well in the community, and they're doing well financially as a result of it. The best example of that, and it's in this book, it highlights that these firms of endearment had 128% return on investment, whereas the Standard & Poor's 500 companies only had a 13% rate of return. That's a dramatic number, and it shows that you can do good while doing good, and that's what we try to do. I will say, for those that aren't sold on those metrics, it is a perfect example to show the type of positive publicity you can get. You saw the article in the Chicago Tribune today. We know Vanguard's going to get great publicity for doing that. I applaud you for doing that. I will say, when we first rolled this out, Stacia was kind. It went over like a lead balloon, quite honestly. It was rolled out to all the teaching hospitals in Boston, and the questions that came up were, what are you, crazy? We're going to lose money. They're going to go across the street and buy it. Why do we do that? It makes no sense. But we took it on, and we took it on in our 2 Boston hospitals, Kearney and St. Elizabeth's. And then we came back in a few months and started to show the metrics. And quite honestly, other hospitals were shamed into doing it. They're like, wow, they're going to do it, so we better get on board. So once again, Vanguard, I applaud you, because I think it should be easier now to get other hospitals to do it when you see one hospital on board, particularly if you're seeing positive publicity come from it. For those that don't sign up, and for those hospitals that decide they still aren't going to do it, there are other measures that can take place. Because I think back to that slide I showed, the community has an opportunity and an obligation to force and to help organizations see the importance of doing these types of initiatives. So this is a small example of a Latino organization that tried to get some of these teaching hospitals that were resistant to get on board. So the question is, do we want the positive publicity that shows that we're doing it, or do we want the negative publicity being forced to do it? Do you want to be the taillights of this movement or the headlights? I suggest the headlights. So now I'm going to dive right into what we actually did, okay? And I'm going to do it because we did it in 2 different approaches in the Boston hospitals. One was a full outright ban, and the other one was kind of a strategic product placement, kind of allowing more choice. And we'll see what you think about the results. So on the St. Elizabeth side, one, the importance of a teamwork. We had all these different players at the table. Obviously, food and nutrition services are key on that. In terms of what we implemented, we basically implemented that same green, red, and yellow format that Stacia showed the diagram for. But essentially, when we actually implemented it, we realized that we had to do a big job of reducing the red beverages. I didn't even recognize we had so many red beverages. We had more than 40 different items associated with sugar-sweetened beverages. And as we started to remove them, people were saying, well, how come you're removing my sugar-sweetened beverage? Remove someone else's sugar-sweetened beverage. They got really passionate about their sugar-sweetened beverage, which is a surprise. But as we started to reduce these, we incentivized healthy beverage choicing through product placement and pricing. We put the water eye level, we made the Cokes and the other sugar-sweetened beverage all the way at the ground so people had to reach for it. We reduced the price, we increased the price of sugar-sweetened beverages from $1.50 to $1.65, and then 6 months later we went from $1.65 to $1.95. Okay, so we didn't do it all at once because that would have been a revolt, but we did do it in a slow manner. And then we dropped the price of the water from $1.25 down to $1, and that was very helpful. Again, we used this model, and we did a lot of education. I'm going to fly through this. We also worked with the vending machine companies, and we had them take off those big Coke, colored Coke red things so that people only saw the clear screen, because we knew these images were in your mind and that it would spur behavior. We also installed free additional water machines in the main cafeteria. Once again, the rhetoric was, how can you give away free water? You're going to lose. We wanted healthier choices, and it didn't bear out. And we also removed the SSBs from the patient menus, and we impacted a large amount of patients by doing so. Ultimately, it was all about education. It was very important that we educated it. We all know in hospitals, sometimes they think all we do is meet. So we had a lot of meetings, and at those meetings, we made sure that we talked about this in every forum we could, in different mediums. And I think education, if there's one thing to take about as you roll this out, this is not a hard program. You'll hear pushback on how difficult it is. One of the biggest things is just make sure you continually communicate it. For consultants, they say 100 different days and 100 different ways, right? Next up, here are the results. So at St. Elizabeth alone, we were able to reduce the sales of red beverages by 54%. And that's in a one-year period. That's in a, from March to December 2010, from March to December 2011. That's an impressive result. We actually had a small increase in the sales of yellow, and we all know there's increasing evidence that maybe some of the yellows, the ways they're sweetened, artificially sweetened, aren't so good for you as well. So it's really important to do education that really promotes the green beverages. And we actually increased revenue from the previous year due to that sales hike for those who continually chose to have their sugar-sweetened beverages. At Kearney, what we did was something different. We started in April 2011. We had a real gung-ho CEO. He said, I want to ban it outright. I said, okay, that's your choice. Some people might not like it, but he decided to do it. And it worked pretty well for us. Again, it was important to have a committee there, particularly if you're unionized. Make sure you have your union representatives at the table. Don't surprise them with this. Not a good idea. Kearney completely eliminated its red beverages, and in doing so, they had increased sales of yellow and green and a decrease, obviously, in the reds because they weren't there. 100% decrease in the sales of red beverages, 139% increase in the sales of yellow beverages. So I think this is an important thing to realize. At times, you take away choices, you might not spur the type of healthy behavior you want, right? So back to, and I'll show it, St. Elizabeth's had a 3% increase in their yellows. Here we had 139%. So folks said, okay, well, I'm still going to get something, and they went to that area. I also think the education was different as well. When we knew we had to get people to come along with us, we educated more. When you made a mandate, there was a little bit less education, and I think the results kind of indicate that. So just by way of comparison, we had distinct results in two distinct different approaches. Both of these approaches were the Boston hospitals. But luckily, I talked to Stacia, and I said, Stacia, can you help us do it in our other hospitals? They're outside of Boston. We have hospitals up and down the Eastern Seaboard. And she was gracious enough to say yes. It was above and beyond our call of duty, but she went to the different hospitals and helped us roll it out in these other hospitals as well. So in the other hospitals, at that time we were 6. We are now 10 different hospitals. So we went to these other 4 hospitals, and these hospitals saw mixed results. And I gotta say, just from corporate, so I'm corporate, and we all know corporate versus the local, this question of, what are you telling me what to do? How are you gonna tell me to sell and what to sell? Talking to 10 different CEOs about what they could sell, not fun. Talking to 10 different kitchen directors about how they should sell, again, not fun. People want to be part of the decision, so I think it's going to be very important to roll it out in a way that if you are from corporate rolling out this initiative across the system, I think it's really important to do it in a way that allows kind of like a directional leadership and not these mandates, A, B, C, D, because people run a lot further in that regard, is my personal opinion. There's a lot of passive aggressiveness that comes when you say thou shalt, so it might not occur. So this is what happened at the different hospitals. The results are somewhat all over the map. At Good Samaritan, we had a 10% decrease in the reds, increase in the yellows, decrease in the greens. Back to the dichotomy between St. Elizabeth and Kearney, right in the middle, 54% versus 100% reduction. That's great. But look at that middle number. You had a 4% increase versus 139. That's pretty staggering. And then St. Elizabeth actually had a higher level of increase in the greens as well. So what we're doing now, we're working with Tufts Medical Center. They're helping us to publish something on this. We're looking at the data, carving the data, because different hospitals have different ways of collecting this data. Some hospitals didn't have the scanner, so it's harder to tell whether or not it was a sale. But for other hospitals, we could just tell how many we purchased as compared to the previous year. So we're putting that together, and we'll have something that can be published. Just want to highlight some of the challenges we encountered. A backlash from some employees over a lack of beverage selection. When you have 40 different sugar-sweetened beverages and that number drops dramatically, it was a dramatic difference for folks to understand and to appreciate. I indicated the challenges with some of those scanners. Some hospitals were scanning, other hospitals weren't scanning, so we had to not sales versus what purchases from our vendors. It was important to get buy-in from our contracted businesses. One of the toughest ones was to get Dunkin' Donuts. I still haven't been able to. One of the hospitals at Dunkin' Donuts, they wouldn't get rid of the coladas. Apparently there's a lot of revenue on those coladas. There's a lot of sugar in them as well. So good luck on the coladas. Next up, what we did was, once I realized, okay, the results were all over the map, I kind of gave folks the opportunity to shape it on their own. Now what can I do from corporate a year later to ensure that the results are more uniform? So what we did was we implemented a system-wide contractor vendor strategy, where we made it a lot easier for them now. Because this is what's happening, and I have these slides actually in your presentation, in your booklet. The next slide is the strategy, so if you want to take it home and adopt something similar. But essentially the highlights of that strategy are, we agreed that no more than 15% of all beverage selections available and in the vending and retail outlets would be sugar-sweetened beverages. So we dramatically reduced that number. We ensure that the consumption of sugar-sweetened beverages will be discouraged by pricing. Okay, so the ones that are healthier would be lower. No sugar-sweetened beverage signage would be allowed in the hospital. And lastly, we wanted to make sure that there were none sold at catering events or on the like. And we recognize that if we're a hospital hoping for healthy communities, that we need to kind of model that behavior, particularly the communities we are in. We are in lower socioeconomic status communities. So here's a copy of the initiative and the protocol for your own benefit. And I just want to end with a slide that we put up to show that this is what was happening in all our hospitals. As soon as folks came in, they grabbed their attention. We showed them dramatically what was healthy and what wasn't. We had sugar in place showing how much sugar was in these different locations, and the results are a result of the education that we put in that regard. Thank you for your time.